and proper cleaning protocols, so that you can sort of implement and really think about the learning from the first 2 sessions. So this presentation is offered on behalf of AWAC, which is Animal Welfare Association of Colorado, formerly CAFAWA. And the Professional Development Committee is part of AWAC, and we've hosted 1 previous training last month, and then we'll be hosting 2 more this year. And on the Professional Development Committee is my co-chair, Carrie Kishiyama. Then there's Heather Grant, Ed Young, Jeff Mendel, and Erin Hickey. So we're all present today. We will be part of your breakout rooms. Please message us privately if you need anything. And we hope that you enjoy the presentation. So today's presentation is called Keeping Our Shelter Animals Healthy and Clean, Contagion Control Practices. We've got 2 amazing presenters today. Erin Hickey is a staff veterinarian at the Dumb Friends League. She's also worked at the League in adoptions, behavior, and animal care for many years before deciding to go to vet school. Erin is passionate about providing excellent care to homeless pets and being able to place as many animals into the community as possible. She also loves teaching and welcomes any conversations on how to improve the lives of animals in every community. In her free time, Erin loves to do agility with her sweet dog, Lucas. He's so amazing. And Elaine Wood is the senior manager at Dumb Friends League Buddy Center location in Castle Rock. Prior to her current role, she was the shelter services manager at American Humane Association, where she had the privilege to work with humane societies from across the country on best practices in animal sheltering. Most recently, she was the director of operations at the Humane Society of Weld before moving to Dumb Friends League, where she started as the animal care manager. She's passionate about ensuring all animals receive the care and attention they deserve while in our shelters. And in my role as community liaison, working with a variety of shelters around the state, I have had the privilege of Elaine joining me and working with organizations from really, really small and really challenging buildings to larger organizations. And I will embarrass her a little that Elaine has gotten so much great feedback from all of those organizations, because she can really take this knowledge and cater it to what it is that your organization needs. So she's an amazing resource. So is Erin, and we're thrilled to have both of them here today. So I'm going to pass it off to Erin. If you haven't announced your name, your organization in the chat, please feel free to do so, because we'd love to see who is here. And I will mute myself.
Okay, here we go. Okay. So I am Erin. I, like Marissa said, have been here at the League as a vet for about 5 years, just a little bit less. And a couple things, please feel free to ask any questions in the chat room as we're going along. And Marissa is going to help me kind of pay attention to that so I don't miss anything. But I want this to be interactive, so I don't want you to have to wait too long. If you want to ask a question, then just interrupt me as you need. A couple other things is that I am not great at Zoom. I've done this kind of class a lot, but I've never done it on the computer, so it's kind of strange. And what I've learned a lot throughout my time as a vet is that there's so much that you don't know until you come across it. So there's a few things that can be done incorrectly, but there are a lot of right ways to do a lot of things. So if I don't know the answer to something, I will do my best to look it up and get back to you at the breaks, or at least I can email you back if it comes to that later on. So I don't have all the answers, so I do my best to get you the best information and the most current information that we have right now. So what we're going to talk about from my aspect are some of the commonly transmitted diseases that we see very frequently, and then some of the other things to consider that might not be that common, but we need to consider the zoonotic potential for you as a shelter worker, for for your volunteers, if you have those, and for the community at large, because if these animals have something that's zoonotic and we're sending it out to a potential adopter, then that's going to be out in the world too. So a lot of these things kind of come together to really affect the community. So we'll talk about that kind of later on. And just so you know, zoonotic diseases are those that can be, we often think about it as something that an animal has that can transmit to a human, but it can certainly go the other way as well. And so you need basically for this thing, for zoonotic disease to be transmitted, you need something that's infectious. You need a way to get it from this host to that host. So route of transmission, and you need a susceptible host, because not everything that just because it has a zoonotic potential and a human comes in contact with it doesn't necessarily mean that that person is going to contract the disease. So there usually is something to do with an incomplete immune system or immunocompromised situation. So we'll talk about that a little bit towards the end. But jumping right in, the one thing that I think all shelters have dealt with is ringworm. Dermatophytosis is another, the kind of the medical term for that. So ringworm is not a worm, it is a fungus, but this is such an ancient fungus that way back thousands of years ago when this was being identified, it kind of forms like a circular lesion on the skin, and it kind of looks like it can have rings around it, and that's just a scaling of the tissue. And so people would think, oh, it's a worm that is burrowed under the skin, and that is not true. It is from a spore that grows up into a fungus. So this is pretty common. I would say we see it in cats way more than dogs, at least at our shelter, but certainly we transfer a lot of animals in, and sometimes those animals will come on a van or truck, for example, and it's mostly cats and a couple dogs. And so when we find out that those cats that were on that transfer have ringworm, then we treat those dogs as exposed to that situation too, because it is a spore, and the way spores basically germinate is through a little fluff of air. So it takes very little to take a little spore and move it from the top of a kennel to inside of a kennel. So just keeping that in mind, and you're not going to necessarily see it, of course. So the way you kind of go about identifying this is there's pretty classic appearance of these lesions. And like on this little kitty's face here, you can see kind of it's not even really circular in this location, but they tend to have a circular appearance. They're alopecic or hairless. They're red, maybe a tiny bit raised and scaly. So some of that tissue is sloughing a bit, but it's otherwise healthy tissue. It is not itchy. So if you see an animal scratching at itself, like kind of like they can't stop, it's probably not ringworm. It typically is not painful, but it can grow, it can get bigger. And when we see these, the kind of the location that you see it a lot is it starts out maybe on an ear tip or at the base of the ear, around the mouth and muzzle, and the paws, because what animals tend to do, especially cats, you'll see as they they groom their face. So it's on their face and on their paws a lot of times. So those are always the areas that you should be looking at if you're looking for somebody that has ringworm. And then we have the woods lamp, which is essentially a black light, and that will glow kind of a bright apple green under the black light. A trichogram is where you can pluck some of the fur from the areas around that lesion. And then you basically look at it, you put it on a plate, on a slide, and you stick it under the microscope, and then you hold the black light, the woods lamp, up next to that slide, and you can look at if those pieces of fur will fluoresce green as well. DTM is basically the plate that you would take the sample with a toothbrush. You kind of comb all over the body of the animal, and you start with the areas that are not lesional, so normal appearing fur, because of the way you can spread it around the animal's body as they do to themselves. If it's on their face and then they lick themselves, now it's on their paw. So when you take a toothbrush, you kind of brush them along, usually the back, the tail areas where you don't see any lesions, and then you end at the lesional areas with the toothbrush. And you basically tap it onto that plate. The DTM plate is going to culture that fungus and see what grows on there if it's there. And then we stick them in an incubator so that they can it'll expedite the growth at a higher temperature. And then every week we will monitor that for growth and how many colonies. So the plate here, that's would be considered like too numerous to count colonies when it's just kind of a whiteout. The plate itself will start out as like an orange color. And then when it is incubated and stuff starts growing on it, then it will turn into this like fluffy snow-like appearance. And they kind of look nice and wispy, and it's really pretty, but it's not good. And the other way that you can do, you'll take a sample of that wispy material, that snowy material, and you look at it under a microscope, and that picture over here, see if my thing works there. This will be kind of like these little canoes. Basically, you can look at them under a microscope, and that'll be like your identification as the M. canis variety. And you would speciate that based on what you saw under a microscope. But if you look at the plate itself, this is a pretty classic appearance of what it would look like if you did have a ringworm positive. If you needed something done really fast and money is not that big of a deal, then doing a ringworm PCR is something you could typically do if you were out in practice and you had a client come in and wanted this. So that would give you a fast turnaround answer, so you could start expediting treatment rather than waiting for the incubation of the DTM plate to give you the answers. Once you've identified it, kind of depends on what you're going to establish as shelter protocol. Like, when are you going to start treating that? For us at Dumb Friends League, if it's above a 7 colony count, then we will start treatment. And then the treatments can kind of vary about whether you're doing just the dips or if you need to start systemic antifungals. Traditionally, the dips or the rinses are going to be the lime sulfur. Those are kind of the old school stuff. And people certainly still use that. And some might argue it is more effective than doing the pure O2. Some of the benefits of the pure O2 rinse is that it doesn't stink up the shelter. And it can change their fur color more of like if you have a black cat, it'll turn them a chocolatey color. That's not forever, but that's the one thing it does. So it's less caustic as far as the smell goes and affecting people in the shelter. The pure O2 rinse you can do once a week. Lime sulfur is typically done twice a week. So those are kind of some variables. If you're looking at cost, yeah, the pure O2 might be more expensive, but you only have to do it once a week instead of twice a week. So there's your, cost as far as your employee time. And then we, of course, collect these DTMs every week and make sure those colony counts are decreasing rather than increasing. And then you might consider adding in the systemic antifungals, which is like an everyday. And for us on cats, we'll do 1 week on, 1 week off, that kind of stuff. So there's lots of different ways that you can come up with a protocol on how to treat ringworm. But it is, this is a zoonotic disease. So that is something to be considerate of when you're dealing with this in a large animal population and how many people are interacting with these animals. So as soon as you can identify it, you need to isolate those animals in a room. So we have a long-term room now that we will keep these ringworm cats in until we can clear them, until their colony count is under 7, and then we can move them along, get them spayed and neutered and up for adoption. So that's kind of the big part of it, is getting it identified early and separating them from the rest of the population in the shelter. And then when you're cleaning out kennels, it's a 1 to 10 bleach solution. And I think Elaine will probably talk more about this for ringworm treatment. And when you have these special rooms that you're keeping, even if it's we have a room called the germ surveillance room. So maybe you don't have the answer yet. Is it definitely a ringworm? Or are we just having some weird hair loss that maybe it could be a wound that's growing back, something like that. Either way, protection should be taken for your staff and volunteers, anyone who is interacting with these animals. Down below here, we have a picture of like what these lesions look like on a human arm. So again, not itchy, but it does kind of have this sometimes a raised appearance, red and circular and scaly. If you're going into these rooms, it is important to do the best to protect your clothing, because again, it is a little spore. It takes one little puff of air and then it is, for example, on your hair. So you should be wearing some sort of head protection too, because you don't want ringworm in your scalp. It's a much easier to get rid of and treat in a human than an animal, but it's not fun to have. And there are people that seem to be a little bit more predisposed to getting it over and over and over. And I know I've worked with people here in the shelter who were so prone to getting it that they would sometimes not even interact and not go in those rooms, and they would still sometimes come up with it. So for some reason, some people can be more likely to get this than others. If you have staff or volunteers that are known to have some sort of an immunocompromised state, they should probably avoid that because they're more likely to get it. But somebody has got to deal with it. So doing the best that you can with wearing an impermeable outfit like this person is wearing. This is overkill. I just wanted to show like what ideally it would look like if you could. So foot covering, head covering, full body covering. We have tried using reusable PPE in these rooms, and if you're not sanitizing them correctly, people were tending to get ringworm lesions around their wrists, kind of where the cuffs come, and maybe the gloves weren't pulled up completely over the arm piece, and around the neck where people, maybe that wasn't being sterilized appropriately. So that's where some of the staff were getting some of their ringworm lesions too. So just things to be considerate of. Next thing, big thing on the shelter agenda is the parvovirus in dogs. So this is a fecal oral transmission. So, and puppies, as we know, are pretty gross. They're usually covered in some poop, even if it's not diarrhea. So we typically will look at a dog, we'll say, okay, it's having vomiting, diarrhea, anorexia, dehydration, lethargy, any combination of these. Typically, our rule of thumb is if you have like any two of these signs, they should certainly be tested. So maybe they're not eating great and they kind of have some diarrhea, but they're bouncy and active and otherwise doing fine. And then we test them and they're parvo positive. And that's a pretty common thing. They don't need to be just down and out. And by the time we see them, we don't know, are they coming out of this and they're getting better, or are they about to get really bad really fast? And we don't know without having the starting point, except for in that moment. So we kind of monitor them based on those signs. And because this is so contagious, it is important to identify this as early as possible and get them separated from the rest of the shelter, but most importantly from other puppies, of course. So we do the rapid antigen test. You'll have your answer in 5 to 8 minutes. And then as far as how do we treat them once we have the identification, for us here, and there's a lot of right ways to treat this. And it kind of depends on how the animal looks in that moment, and then how they are doing the next day and the next day and the next day. So sometimes we'll start out with a sub-Q protocol, which is where we just give sub-Q fluids once or twice a day. And they all get an injection of convenia. That's to start with, and that's just a one-time injection. They'll get an injection of Serenia, which is an anti-nausea medication. They'll get that every single day. And then kind of going from there, that's the minimum that they all get. After that, if they get worse, you can switch over to the IV antibiotics, and like on top of what they already had, the convenia, you can do IV fluids. You can spike those fluids with electrolytes and dextrose. And there's other anti-nausea medications, injectable, that you can add in on top of that. We have appetite stimulants that we can do. We have enteral feeding, which is basically taking like syringe feed and just forcing it down their throat. There is evidence that shows like early feeding, getting them eating earlier, is better for the health of the enterocytes, which are the cells that line the entire intestinal tract. And what you want there is to prevent sloughing. So if we can keep those cells nourished, then that might be better outcome for the animal and they might recover more quickly. But it's a fine line, because if they're already vomiting because they're so nauseous, then putting more food down their belly is just going to kind of propagate that more of that nauseous feeling and maybe make it worse. So you kind of have to see how the animal, each individual animal is doing before making that decision. Some things that we find too is that some of these guys, they'll be in the parvo ward for so long and they're better and they seem to be doing fine. Maybe even we retest them and they're negative, but they are still having diarrhea. And then you realize, oh, well, maybe if they didn't get a vaccine to begin with, they probably didn't get any dewormers. So maybe they have some other GI parasites you have to kind of take into account and treat those too. And of course, pain management, we use buprenorphine. You can do that every 6 hours, 8 hours, 12 hours, whatever works for the situation that you have and what you're able to provide. But that's another good one. The one unacceptable thing as far as treatment is not doing anything. So minimally, if this cannot be treated in any fashion in the shelter, then euthanasia should be considered, because it is unlikely that they will turn around and pull out of this without any intervention. So doing nothing is wrong, but there's a lot of ways that you can treat these animals. And even if that means transferring them to a different facility, that's also an option. So as you know, the best way to prevent this is vaccination. So that's just, what are you going to do? At this point, they already have it. But if you want to prevent it in the population, make sure those animals that are coming into the shelter are getting vaccinated right away, and that you have a good vaccination protocol. And on what timetable do you guys want to do that at each of your shelters, and making sure that those checks are in place to make sure that everyone is getting revaccinated per your protocols. And then isolate those animals. So once we have a puppy that clears out of parvo, we get them spayed or neutered, we try to make sure that they're never sharing, for an example, like into a kennel space that would share a drain with other puppies, that were never affected by that. Because the vaccination it's really, really good, but nothing is 100%. And so when you have an incomplete vaccine in the young puppy, that even if it had one vaccine, it's very good protection, but it is not complete. And so you don't want an animal known to have had parvo to be exposed or be in close contact with another puppy who has an incomplete vaccine status. They can be close by sharing drains with adult dogs that we know have been vaccinated, and is unlikely that they would get it at that point. And then very important, so when we have been running through these PPE shortages over the last year, one of the things that we didn't make any compromise on was the parvo ward, because of how devastating this disease can be if we are moving it around the shelter and you have a parvo outbreak. It's really bad. And so that's one thing that we didn't skimp on. We saved all of our disposable PPE for our parvo ward. We use hair coverings, face coverings, because sometimes they feel pretty good and then they lick your face otherwise. You have to make sure you're covering your face. All the way your wrist should be covered by the sleeves, and then the glove should be pulled up over that. And I like how this woman down here see how she is sitting in the kennel with this dog, but she has something actually covering up her legs. So if you can't find, and in we have a shortage of like kind of those disposable pants right now. So we're making sure that when it's possible, we put all of the dogs, all the puppies that come in on the upper kennels. That way no one's needing to bend down, because if you do, you need to make sure, like she's doing, that your legs are covered up, because anything that goes in this room really shouldn't be coming out of this room until it doesn't have parvo, which are never going to be the clothes. So everything that people are wearing should be thrown in the trash when we're done here. And the same with bedding. Bedding never should be washed. Once it goes into parvo and that towel that's in the kennel is ruined, it goes in the trash. That kind of stuff, because this virus is really stable in the environment for a very long time. So putting that into a washing machine situation don't do that. Just throw it out. It's not worth getting the whole population sick. And then once you have, every once in a while you have a parvo ward, you'll have time, maybe sometimes in the winter, you might have some downtime with no parvo. Make sure that you have a good deep cleaning protocol in place while there's no animals in there, that kind of stuff. Like I said, once it goes into the parvo ward, it doesn't come out until it doesn't have parvo. So, and then the other version of parvo is the panleukopenia virus in cats. And in fact, this is the older virus. And at some point, the panleukopenia virus jumped ship from cats and became its own parvo in dogs. So it's essentially the same disease. It's not the same now. So dogs can't give it to cats and cats can't give it to dogs. This is thousands of years ago. So this is another really old one. Essentially what happens here too is this name implies pan means across the board and leukopenia means no white blood cells. So it's all the white blood cells are depleted. And that's what happens in dogs too. I actually don't know why we call, one panleuc and one parvo. I don't know that, but you can use the same parvo test. So that's kind of cool. It'll pop up the same way. So everything about this is the same. It's a fecal oral transmission. Even though kittens are cleaner than puppies, generally speaking, they still generally have some poop on them. And when it's diarrhea, it's hard to not have it kind of everywhere when you have a litter of kittens. So again, based on your clinical signs, so the vomiting, diarrhea, anorexia, dehydration, lethargy. And again, we test when we start seeing 2 of those signs in any kitten, we should really be considering testing them. And it's the same way you'll have your answer in 5 to 8 minutes about knowing whether or not you have this in the litter. Everything else can be the same, but you usually, unfortunately, have about a 90% mortality rate with these, whereas like you have an 80% success rate with treating parvo with just the sub-Q protocols. So they have a much worse outcome typically. So we don't treat this at our shelter. What we do right now is when we have a positive, so we have a whole litter of kittens that come in, and 1 or 2 of them, they've been eating, but maybe one of them started vomiting, one of them's not really eating, that kind of thing. Ideally, you would test the whole litter and say who's positive and who's negative. But that is not always going to be a realistic thing for a lot of shelters and rescue groups to do, because these tests are not free. So you kind of have to think about like which one should I test? Certainly test the ones that are clinical, are showing signs. Separate them because the other litters might be fine. The other litter mates might be okay. It just because they're exposed to it doesn't mean they're going to get it. It's kind of the nature of how this works. Typically what you should consider doing when you have that is, euthanize. I usually euthanize right then. When I have a positive test in a kitten, even if it's a bright, active kitten in that moment, they can turn on a dime. And if that happens in a foster home or where no one is here overnight, I don't want that kitten suffering and dying in a cage by itself. So my opinion is that euthanasia is the best route to go in that moment. And then you can watch the rest of the litter and see how they do. If you already have 1 positive test there, then you can watch the other kittens. And if they start declining, then I would consider euthanizing them too, because the likelihood is that they probably have the panleuc virus as well. We do, of course, have the vaccinations as a way to prevent this, but once they get it, the kittens just don't fare well. As far as then we get into the URI in dogs, and just like with people and a cold, this is transmitted through coughing and secretions and direct contact. People can act as fomites, and a fomite is basically a way that you can get a bug onto your clothing, onto your skin, something like that. And then you go interact with the other animal who licks you or brushes up on you, something like this. And now they can get it because it is transmitted basically through mucous membranes, which is, all over your body, your nose, your mouth, your eyes, all those spots. So with dogs, it's kind of, again, the appearance of the dog Kennel cough is kind of the big one that we deal with. Usually you don't have to intervene with these guys, but if you do have anything that's like discharge, so most kennel cough is just that dry hacking cough, gets worse at night when they're trying to sleep, gets worse when they're pulling on a leash kind of thing, but they typically don't have a lot of, secretions from their nose that is yellow, green, something like that, that might indicate that you should be adding in antibiotics. There are other ways that you can test for this too. So you can do a PCR for respiratory panel. It's pricey, but if you're having an outbreak and we had an outbreak of pneumonia in our shelter a few years ago. So we started testing these dogs and sending in a PCR sample for PCR to the lab, because we needed to identify what kind of bug we were dealing with and what kind of antibiotic we should be using to kind of squash the outbreak. So that might be important then, but if you just think, oh, it's just a run-of-the-mill URI, then you kind of treat them as needed. We have cough tabs, which is very similar to Mucinex, or you have to add in some antibiotics. Dogs typically do okay with this, but it's kind of sometimes if they're not eating, you might add in an appetite stimulant. They always get their vaccines, and again, the vaccine protocol that your shelter wants to use, and make sure that if they have a longer stay in the shelter, that they're getting their next vaccines accordingly and not waiting too long. And as soon as you see a kennel cough, you have suspicion of that animal should get moved out of the general population, away from like shared drains, and in close contact, which is very challenging when you have a shelter full of dogs and you don't have a lot of space. You would need to be thoughtful of where you can put an animal that could potentially infect the rest of the population. They do need to be separated. And then once you get that under control and you move all those animals out of those special rooms and do these deep cleans and make sure that there's no bugs that are just left over in case somebody comes in the next day or 2 days later. And remember, consider yourself as a fomite. You don't want to be responsible for moving this bug around the shelter. So washing hands, once you identify an animal, you guys should have in your shelter minimally have a bunch of extra, like a scrub closet, because if you get it on yourself, you find out the dog has kennel cough or anything else, and you can go change, get that stuff washed. And at least you're not in, once you're in the room though, make sure you have something. We've been using kind of like the reusable cloth gowns, our old surgery gowns. That way when you go in a room, you're covering up and then those get washed again, but you're not moving it from inside your URI room out to the general population. You take that part off and then your clothes underneath should be clean in theory. And a good hand washing as well is very important for all of these things, obviously. When we have, I think we probably see this more than dog URIs, cat URI and calicivirus. And calicivirus is kind of one of these presumptive diagnoses because you don't know for sure unless you do a PCR that you have calici, but it's kind of the most common thing that you'll see that causes a bunch of ulcers on the tongues. Herpes virus can do it too. So you treat them both the same way. Ultimately, it doesn't matter, but identifying that you have an outbreak of lingual ulcers in your shelter, whether it's from herpes or calici, you're going to treat it the same way. But certainly you got to get those animals separated out from the rest of the population. Or if they're already in a colony, consider, that maybe these other cats in the colony aren't showing signs of having URI or lingual ulcers yet, but you need to keep an eye on them because they probably will. And moving them from that room might cause more stress, might make it worse. So generally in a colony situation, you might consider just leaving them there. But cats can get very sick very fast. As we know, cats can kind of hold this in and not let us know how sick they are until they're very sick. And a lot of cats start showing that by not eating or not eating as much as they usually do. So at our shelter, we keep track of what cats are eating every day. Are they eating wet food? Are they eating dry food? Are they eating all of it or only some? And then we try to get them in to see a doctor or technician when they stop eating the way they used to be, if there's a sudden change in their eating, so that we can get in front of this more quickly than anything else, because it can spiral very fast. So we can see upper respiratory that typically starts out as a virus, and it's usually just sneezing, maybe some congestion, and no nasal discharge or clear nasal discharge. And it can kind of turn into something that is requiring antibiotics because there's a bacterial infection on top of the virus. And so adding in whatever appropriate, like we use doxycycline as our first round of antibiotics for cats. But then if that doesn't work, we have other options to jump to. Typically, it is really common to see a cat with URI and conjunctivitis at the same time. So it is thought that they are very tightly related to each other. So you might have to treat both of those at once. And if you really wanted to know, oh, what do we have? What kind of virus is causing this? There are ways to do a PCR, like a respiratory panel, or if you wanted to find out, is this Policea, is it herpes? There are ways to find that out. But if you're going to treat it the same way, it kind of might be not money well spent, but it is an option if you're interested. So it's the same as dogs. So we typically will do supportive care. For me, when I see a cat who has URI and is not eating, they get sub-Q fluids and they get a Cerenia injection, which is that anti-nausea, because when cats aren't eating, they typically will feel nauseous, and that can kind of get them over the hump of not eating. And once you can get them past that, they start eating again, then they tend to clear their URI a little bit faster, rather than just jumping to shoving medications down their mouth, because again, this is mostly born of stress in cats, and it just can get really bad really fast. So as soon as you can identify that these animals are breaking with URI, we have rooms here at the shelter at DFL where we call them like our upper respiratory 1 room. So they're just sneezing and there's serious nasal discharge and nothing else. And then we have URI 2 and 3 rooms as well. So maybe that room starts out as URI 1 and 2 days later, the whole room is on antibiotics because it's a level 2 or level 3 URI. So all things to consider. If you have a big kennel room and they're all breaking with URI, rather than moving them out of that room into a separate space, maybe consider, should we just leave them where they are right now? Because we know that moving cats from kennel to kennel to kennel is very stressful. So you do that as little as possible, and that will decrease their stress by decreasing handling. And there's this great vet, she's in this picture right here. Her name is Sophia Yin, and she's done it. She's a behaviorist. She passed away, but she has a great book out there on kind of like low stress handling for dogs and cats. That is a great source of information. But from a shelter perspective, that maybe not moving cats around the shelter could be something that you think about, rather than saying, oh, it's got URI, move it out of this space to somewhere else. And once you have that in a room and all the cats are moved out, try to keep that room kind of vacant if you're able to, so that you can do deep cleans as you clear out that space. And again, once you know that you have URI or calicivirus is really careful, it's super easy to spread, and that's the one that can cause a lot of damage to cats by not eating. So making sure that you have that good PPE, early identification. Again, you can just use like an old surgical gown or old scrub top, and just when you're done handling that animal, take it off and make sure that the clothes you have on going to the next healthy cat haven't been contaminated. So now we're kind of getting into a different, less common situations, but more zoonotic potential. So toxoplasmosis is it's a fecal oral contamination. So this is something that is shed in the feces of cats. It's typically like a little GI parasite that cats pick up from the environment. It could be from eating a dead rodent or something like this. And essentially when they defecate, it is in the stool. So we have heard about this in the past. Some of you might remember, like they used to be like, oh, like pregnant women used to get rid of cats because their doctor told them if you scoop this litter box, then it can cause your fetus to die. And that's not really true, but there is a potential for really severe fetal defects and miscarriage if this happens while a woman is pregnant. So I typically recommend that pregnant women in a shelter should maybe consider not doing litter boxes. But if you wear gloves and minimally wash your hands before you eat, then this is not going to be a problem. The other thing is that most people that have had animals at any point in their life have had exposure to this little GI parasite. And if you've already been exposed to it, it's not going to be a problem for you in pregnancy. The problem comes up when it's a novel or new GI parasite that you're exposed to while you're pregnant and immunocompromised, because pregnancy is a state of being immunocompromised. So basically, and the other thing that you can do is if you're scooping a litter box, so this basically won't be a problem if the box is scooped every 24 hours or earlier. It becomes a problem when the feces is able to sit for over than 24 hours, and basically it kind of sporulates, and becomes a problem when you scoop the litter box, don't wash your hands, and then have a snack. So not a big deal, but it does have potential to be devastating if it happens in a novel patient. Rabies we're all very familiar with. So this is also a very devastating disease. It has like a 99% mortality rate. There's very few people in the world who have survived rabies. But the way it works is that the animal has to be shedding that virus in their saliva at that time. So kind of a tricky virus, and I kind of think about it like the zombie virus. And so if an animal has it, and we typically see this from like a wildlife interacts with a domestic animal, and if that wild animal was infected and shedding it in their saliva when they bit the other animal, if they're not vaccinated, then they have potential of getting sick very quickly. And what we have to do here as a safety precaution is that we hold animals back once they've bit a human for 10 days. And 10 days is kind of like above and beyond where you would already see a problem. So in cats, the cats are clinical for rabies. They typically start showing signs, neurologic dysfunction within about 3 days. They're even usually dead within 2 or 3 days if they have it, of when you start monitoring. And then that will give you time, as like if you have a cat who bit somebody and it died or started showing neuro signs within a couple of days, and you get that person who is bit to some place where they have rabies vaccines, and they will do what is a post-exposure vaccination protocol. So there are ways to get a pre-exposure vaccine ahead of time, but there's a way to do it after too. But that's why you have to monitor for those signs to make sure that that person gets in and starts getting the vaccine right away. So unfortunately, though, animals can harbor this in their basically in their nervous system for an extended period of time. So if it is in the nerves and they don't show any signs within 6 months or something like that, maybe it's never going to be a problem. The thing is, even if they have that, if they're not shedding it in their saliva, even if they bite you, they cannot transmit that to you. So they need to be showing neurologic signs and having it being in the saliva when they bite you for it to be a problem. But it is very dangerous, and people die of this. But because we have such a good vaccine protocol in this country, it is really uncommon to see that anymore. And certainly we haven't had a case of it in Colorado for, I don't even know when, but you'll see this a lot of times in the spring and summer, where you will have some sort of an exposure. Oh, somebody, for example, a few years ago, I'm sure some of you would remember this. It was in northern Colorado. Somebody found a litter of raccoon babies that had been abandoned. And probably because the mom had rabies, and that person took them in, were handling the animals. No one got bit, but one of those babies or two of them ended up being positive for rabies. So then there were, I think, 20, 30 to 50 people, something crazy, that had some exposure with all of these little baby raccoons. So those are things you have to be thoughtful of, especially if your shelter or rescue accepts wildlife, and try to have people who have been vaccinated for rabies be the only ones exposed to those animals to be extra safe. So less scary is salmonella. Yes, people can die of this, but it is less likely. So this is another fecal oral transmission, and it can be other animals, but from a shelter perspective, you can have chickens that can shed this, if your shelter takes in those kinds of animals, and reptiles. So ideally, you are wearing gloves when you're handling reptiles and animals that can transmit this, but if you're just washing your hands before you eat, you should be fine there too. But again, anyone who's immunocompromised should consider not cleaning these kennels and handling these animals. Giardia is a common one that I think we all deal with pretty frequently. So you see it in dogs and cats. So it's a fecal oral transmission. It can also be, as you see this little kitty drinking from this maybe standing water, even a stream, because this can be carried and shed in feces of kind of wildlife. So if you go up camping, for example, and you think that this mountain stream water is not contaminated, you're probably wrong. So be careful about that. Because when animals go to drink water from a stream or a lake or whatever, they tend to kind of urinate and defecate at the same time. So it's going to be seeping into that groundwater. So just, don't be drinking water that seems clean, because you can get really sick from this. And it is possible also to die from this because it dehydrates you without any treatment. So, and the other tricky thing is that this can be shed kind of intermittently, and people will sometimes say, hey, once you have Giardia, you always have it. So you might have it at a really low level, and any little insult to the GI tract, any stress or any other virus that you might get could cause that to kind of come up to fruition again and have a new population of Giardia that you're shedding. Same things in dogs and cats. It can take a long time to really treat this effectively to where they're not having diarrhea. It's mostly diarrhea, but I have had a few patients that were also vomiting, because if they get kind of an infestation of these protozoa in the kind of the upper GI tract, like the proximal, the early part of the small intestines, then that can cause so much inflammation right there that they can vomit from it too. So keep that in mind if you see that it can cause that. It's mostly just diarrhea. And it is pretty easy to treat once you identify it. Frankly, if we have animals in our shelter who are having diarrhea and we submit a fecal sample and it comes back negative, a lot of times I'll start treatment for this anyway, because it is so intermittently shed that it just might not be in that sample that we submitted to the lab. So keep that in mind. Again, washing your hands after you handle animals of all kinds, anytime, and 100% before you eat every meal, hands should be washed just in case. And this is something also to consider if there are, kids at home, where, obviously we adopt out animals to families that have children. So this is something that hopefully parents are being thoughtful of as well. Because puppies and kittens usually have poop on them, and kids don't have great hygiene, don't wash their hands. So trying to practice really good hand hygiene is important. Cat scratch disease, we've heard of. I've seen this in the shelter plenty of times. So basically, this is from a bacteria that is inside of a flea that bites the cat, and then the cat is kind of carrying it, not really clinical for the disease, but you get scratched, and then now it's in your skin, in your blood system, And what happens is it kind of acts like this really bad inflammatory process that causes, for the most part, like inflamed lymph nodes. And another thing, so when you go to the doctor for your inflamed lymph nodes that are kind of everywhere under your armpits, it's, you know, you have lymph nodes all over your body. But that often looks like lymphoma to a lot of doctors. So, and there was somebody that used to work here that got this, and they wanted to start chemotherapy because they thought she had lymphoma. And then at some point they were able to figure out, oh, I think they did like a little, a culture, took a sample of lymph nodes because you want to make sure before you start chemo. And it turned out it was just a little Bartonella, a little cat scratch disease that can just be treated with antibiotics. So it can be very scary. So if you be careful when you're handling cats. If you know a cat is overstim, be very cautious about getting swatted. Wash very quickly and report those bites, because if it is something that happens at work, it should be covered by workers' comp, that kind of thing. We don't see this a ton in Colorado because we don't have a big flea population, but certainly they're around, and especially out in, you know, cats that live in the community and aren't predominantly indoor, they're going to be exposed to more fleas. Every animal that comes in our shelter gets, you know, the first thing they get their vaccines, they get frontlined, and they get dewormed the second they come in. So hopefully that helps. It doesn't mean that the cat may not already have that in their system. And again, if immunocompromised, you should be cautious and very aware of when you get injured, that you're taking, you know, careful hand washing measures very quickly. Leptospirosis, or lepto, is another kind of bacteria that can be kind of scary in people. And what you'll see there is kind of general flu-like symptoms, general malaise. You really kind of feel crummy. You can start showing signs of like icterus, or when you become yellow because you might be in liver failure. And it is transmitted typically through standing water, is also transmitted through urine. So, and it can be like if urine got splashed in your face, for example, and you got it, you could go through your mucous membrane in your eye, you can get it that way. And people and animals can get very sick from this. So early identification is very important. And then really all you need are some antibiotics, but it can take a long time to recover from that. So if we can identify that early in an animal that we're suspicious of, and be really careful who is handling that animal, and making sure we get those answers as soon as possible, start treatment as soon as possible. And sometimes this gets to a point where it's so bad that euthanasia honestly should be considered in these guys, because sometimes the damage to the liver and kidneys can be really, really far along before we figure it out, and can be sometimes no coming back from that. I'm going to try to speed it up here, so I think we're getting to the end, but we have the plague, or Yersinia pestis. This is another little bacteria that is transmitted, and I know you guys have all heard about the plague. And this is, everyone thought it was rats, and it was the rats that carried it around, but it was the fleas on the rats. So this is something, just again, keep in mind, it'll make you feel have general malaise. You just don't feel well. You might have lymphadenopathy, which is swollen lymph nodes everywhere. We see this a lot of times in Colorado, prairie dogs that are carrying fleas. So even though fleas are not a huge deal in our domestic pets, prairie dogs carry them. And cats that go outside to play with prairie dogs and try to eat them, they might have this. Bring it into your home, because fleas are sneaky like that. And if the flea, even though it's not going to bite you repeatedly like it will on an animal, because your core body temperature just isn't high enough, but typically the flea, if it's on you and there's no other person, no other thing to bite, they're going to bite you. And fleas will regurgitate a little bit every time that they feed. So that is something to be considerate of, and that's how you can get it. Eilerichia, or walking dandruff. This is one, we had a little outbreak of this just a couple weeks ago here. But as soon as you identify it, you kind of picture frame those kennels off, because it is highly contagious, but they're just little mites that are kind of on the skin and the fur. And you'll see that picture of that rabbit up there. That's from barbering because he's so itchy. They don't burrow under the skin. They do live on the skin, and they kind of carry around these little your skin cells that are dead. And the animal gets like very itchy because these little mites are kind of crawling all over their fur. Super easy to treat, but it is very contagious. So you got to identify it early, start treatment right away, and make sure that everyone in the kennels around these guys are kind of considered exposed, start treatment for them, and then move on. Now, I have seen this in humans. I had a volunteer a couple years ago that showed me I don't generally like looking at skin stuff on people, but she showed me, and I was like, well, let me see your kit. And I look at the kit and I was like, oh, it's kylots yellow. And these little bugs will bite. And they were these tiny little red bumps all over her arms. And as soon as we treated the kitten, she never had a problem again. They typically will not bite people, but you can see that if you have an animal. This is one that is, so scabies, these mites will burrow under the skin and lay eggs under there. And that is intensely itchy. It can really affect the quality of life if these animals aren't treated quickly and aggressively. And it is in people too. It's very, very itchy. So typically some of these skin stuff, they're not going to cause a lot of itch, but scabies will. And it can take a long time to treat these guys. So, and they should be, everything that goes into that kennel should not leave that kennel. Bedding should be turned over frequently and thrown out and in a bag, because the bedding is a source of contamination. So animals that are using shared bedding, they'll all get this. Strep zoo is not typically zoonotic, but it can be transmitted in like animal, like food products that are not treated appropriately. But it is important to know, because when you have an outbreak like this, you can sometimes, and this happened before my time, there was a strep zoo outbreak here at DFL. And you know, they came in and a bunch of dogs had died overnight, and they just had mild URI signs. And then they came in and found several dogs had died of this overnight. So, and can be common. It's something that we more can think of when you think of like guttural pouches in horses getting kind of infected like that, but it can cause these very acute, very dangerous respiratory signs where it's a little URI and then there's blood coming out of the nose and they can't breathe anymore. So it happens very quick, and it can be seen in kind of like large housing environments. So when you have that, again, identify early, separate from the rest of the population and see if this is going to happen. Then we don't want it happening to every animal. It is rare. It's just something to be thoughtful of. And at that point, maybe doing a respiratory panel to find out is super important. MRSA is something that we hear about a lot in humans, animals, everything. So the dog on the left had this skin infection. It was MRSA. And then the one on the picture of her on the right is where it's resolved. So it's an antibiotic resistant strain. It is very difficult to treat, and it doesn't mean there aren't any antibiotics, but if they're not the general antibiotics, you typically have to special order this. It's typically a really long time, and it's like 2% of the population of humans are carriers for this. So it's just kind of on your skin in general. So we see this a lot in hospitals and nursing homes. Sometimes it starts out around like a catheter site from like an IV catheter kind of thing, and it can spiral very quickly. So if you're starting antibiotics on a pet and it's not working, you should consider culturing it and making sure that you don't have a resistant bacterial strain somewhere, because it's not going to work unless you get the right antibiotic on it. But it's dangerous, can be very expensive, and really take a long time to come back from. So biologic risk management for a shelter setting is, again, I've said it like a bunch of times, so just making sure that you can identify these problems early, separate them out, and treat those appropriately, because The quicker that you get these under control, the healthier population is, the quicker you get them out and adopted to new homes. When we talk about kind of our usual suspects, we've talked about this already, but think about this in relation to what are you bringing home to your family and how to protect the rest of the population in the shelter. So you want to, and Elaine is going to talk about this too, but using liquid soap, not bar soap, certainly not in a setting where multiple people are using it. And anytime you can keep your hands moisturized in a moisturizing soap, it protects your skin barrier and prevents anything from getting through those little cracks. Alcohol, hand rinses and rubs, those are good, but the best thing to use is like a liquid soap. And then if you are concerned, wearing gloves and sleeves, so you don't want to gap at your wrist there. If you know you're going to get something, it could be right there. Some things that you can think about using in your shelter or rescue is any protective equipment to kind of protect your eyes, your face. We don't really use any like caustic cleaning agents here anymore, but they're out there. And so using kind of a protection for your respiratory tract. And there used to be stuff out there that you would spray in a kennel and you'd start coughing right away. We don't use that anymore, but if you're using something like that, make sure that you're wearing a mask to protect yourself. And communication of risk. So in all of our rooms throughout the shelter, there is a sign up saying, in this room, we are treating such and such. And here's what you need to wear on your body to keep yourself and these animals safe. So we tell people, like, please make sure you're reading the signs. And even if I see something and I don't necessarily agree with the sign, I don't want my volunteers seeing somebody else, oh, the doctor's walking in and doing that. So you follow the signs to be a good leader. In the shelter, making sure that laundry is frequently going. You may or may not see foot baths every now and again. Right now, the current data is that they're really not that effective. And so wearing disposable or rewashable shoe covers are better, but you never know if that's all that's available. It's probably better than nothing. And I know we use that in school for like a large animal. There were always these like bleachy foot baths for coming in and out of stalls that had animals that were contagious with something. And making sure that animals that, if it is contagious, are we able to move it around the shelter in a carrier? But a dog that has URI probably shouldn't be walking on a leash through the hallways because of that contagion. And appropriate clothing. Mop buckets should be cleaned frequently. And I do mean more than once a day. Water should not be black or brown or gray. When you are coming and leaving from work, I have shoes that I have for the shelter that I don't wear outside the shelter. I keep them in the garage. Some of my colleagues keep them in their car or their locker at work. Just making sure that you're not kind of moving things out of the shelter and bringing them into your home. Make sure your animals are vaccinated, because there is a chance that you're going to have something on your clothing that you go home. And when I go home, I shower right away, and those clothes all go into the wash right away. Just an abundance of caution to not have animals at home that could be immunocompromised, or even your other human family members that could be susceptible to. And then paying attention to those signs. So everything in the shelter is kind of about just stop and think about what you're doing and how you can help preventing disease and the spread and keeping animals healthy and keeping you healthy. And other resources that I have found that have some good webinars and vaccine protocols and just information about general sheltering are these through the ASPCA, through HSUS, and the UC Davis program for shelter medicine. And then this is my information too. If anyone wants to talk about something, in private, you can email me, and this is our number to the shelter. If I'm here, our customer service people can page me or find a way to get a hold of me. So feel free to reach out. If I can be a resource for you, I would be happy to help. So that's it for me.
Thank you so much, Erin. That was amazing.
Yeah.
When you said MRSA, I thought you said Marissa. And I was like, oh, wait.
Oh, sorry.
No, it's funny. Okay, so we're going to do a little bit of Q&A right now. There's no questions in the chat, but we would be happy to take some questions right now if anybody has any. We'll give folks a minute or so. Okay, here's one. Do you recommend vaccinated staff pre-rabies?
So I'm terrible. I'm not vaccinated. I'm going to get vaccinated. I just couldn't afford it in vet school. If you are handling animals, there are staff that we have, not only the vets that are vaccinated for rabies here, and that is because we need staff. We have animals in our care that have been exposed, and you're going to need some people that are able to handle those animals. So a lot of technicians, most of the vets are vaccinated, and then some of the supervisors are. If you're doing things like, so ideally when we have a rabies situation or bite, we try to hold the animal if we can safely and humanely for 10 days. If we can't, for whatever reason, the animal is unsafe to be housed and is too dangerous, then we euthanize and we will decap the animal and send the head in for testing. Anyone who's doing that should be rabies vaccinated because of that potential. While it is very low, it is safe to, it is probably in the best interest to have those people doing that. But certainly most of the people who work at Dumb Friends League are not vaccinated.
Thank you.
If that is helpful.
Dr. Hickey, could you put your email address in the chat just so folks can copy and paste it if they need it moving forward?
Sure.
Because in the interest of time, I think what we're going to do, since it's about, oh wait, hold on, here's one more question. For parvo in dogs, is there an average time from contraction to death caused by the virus if left untreated?
You know, I don't know. I don't know. I'm sorry. And it kind of depends on, you'd have to know exactly when that animal had the virus, and then you had to do nothing about it and watch it. And the reality is some dogs get it and have a very little reaction to it because it depends on kind of the strain. And then typically what I see is if we didn't do anything about it, the ones that are more likely to die from it are these very, very tiny, like Chihuahuas, who are, 6 weeks old. Those ones don't do well. Typically, the larger breed dogs and the older they are do a little bit better. I don't know if it kind of depends. There's so many variables. I just couldn't answer that to say how long until they die. It really depends on so many different things. I will say, and you guys probably know this, but there is black and tan dogs and pit bulls are overrepresented as far as who gets parvovirus. Doesn't mean that they're more likely to die necessarily, but you just see more of those dogs. And we don't know why it is. Is it something in the population? Is it something genetically that makes them more susceptible? But there are too many variables to say from this to this is when you would die. It's too different.
Great. He said, understood. Thank you. Awesome. So in the essence of time, it's 2:11 right now. What we'll do is we'll just take a 10-minute break, actually a 9-minute break. We'll have everybody come back at 2:20. And that's when Elaine will pop on and talk about cleaning procedures. And yeah, we'll see you back at 2:20. So Erin, you want to, we'll have you stop sharing and then we'll have Elaine share.
All right.
Perfect.
Cool.
We try this again. Oops. Did that work, Marissa?
Yep.
Okay.
And Elaine, I will say hello and then pass it off to you. So you're not like, when do I start? What's happening?
Okay. Thank you.
You're welcome. Okay, so it's 2:20. Welcome back, folks, and I'm going to pass it off to Elaine Wood.
Oh, I'm sorry. I thought you said wood. What? Not wood. Hi, everyone. I'm Elaine Wood, and like Dr. Hickey, I'm also not the most Zoom knowledgeable person on the planet, so hopefully we'll get through this. I'm the animal care manager at the Dumb Friend, or the senior manager at the Buddy Center for the Dumb Friends League, like Marissa had said, and I'm here to talk about kind of the cleaning part of disease prevention. And I can talk about shelter cleaning all day long. I kind of am a geek about it. I have my degree in microbiology, and so I can really kind of get into it. So here we go. And I would like to second what Dr. Hickey said as well, in that there are a lot of right ways to clean shelters and look at sanitation and disease prevention, but there's also some wrong ways. And we spend a lot of time and energy cleaning and disinfecting our shelters, and we rely on this as a major prevention for against disease. But if it's performed incorrectly, it can definitely be ineffective. It can be very costly and actually serve to cause harm and spread disease instead of protecting the animals that we're taking care of. And nothing is more frustrating than to spend hours of hard work, a lot of staff time, providing what you think is the best level of care, only to find out it's not working like you hoped, and you're in the middle of a parvo outbreak. And we really can't, for most of us, we don't control the animals that are coming into our facility. If it's in the community, we are going to see it in our shelter. This certainly was true with canine influenza when it kind of reared its ugly head. If you have parvo in the community, sooner or later, you're going to have parvo in your shelter. And so we really want to build cleaning protocols around how these diseases work and what's the best way to manage them. So my goal for this presentation is to help you kind of work smarter, not harder, when it comes to cleaning and preventing disease. I think it's easy to think cleaning is a pretty easy and straightforward thing, but when you really dive into the topic, there's a lot of very complex information that kind of plays into this, and there's a lot of variables involved. Okay, so the first thing I want to talk about is kind of some sort of principles and definitions so that when I'm talking through this, you kind of understand what I mean when I say a product cleans and disinfects. Because we'll often find cleaning, disinfection, sanitation sort of used interchangeably, but they actually mean very different things. When I'm saying cleaning, cleaning is the physical removal of foreign material or organic material from the environment. So cleaning physically removes those germs, those body oils, skin, hair, that kind of thing. It doesn't kill the microorganisms. We're really talking about removing them from the environment. So it's accomplished with water, detergents like soaps or degreasers, and mechanical action. And those soaps and detergents sort of work by suspending that dirt and grease and the germs inside the soap so that it can be washed away. And degreasers, when I talk about degreasers, they're really a more powerful detergent. It's actually formulated to kind of penetrate those layers of dried on body oils and greasy debris. So if you are looking in your kennels and you kind of see that sort of gray residue on the sides of the walls, chances are that's really from a buildup of, again, those body oils. And so getting in with a good degreaser and some elbow grease to kind of lift that away would definitely be recommended, because that layer can really harbor a lot of viruses and bacteria that can be causing disease problems in your shelter or rescue. When I talk about disinfection, I'm talking about the actual inactivation of disease-producing organisms by using a disinfectant. And there's a lot of products that are listed as disinfectants: rescue, bleach, products that are related to bleach like Wizzy Wash or Brew Clean, your quaternary ammonia cleaners, or quats as they're called, which are Parvosol, Kenalsol. There's a lot of different names for your quats. So those are all common disinfectants we'll see in a shelter. And then when we talk about sanitizing, we're actually talking about lowering the number of germs on the surface of objects to a safe level. And this is often judged by a public health standard. This process works either by cleaning or disinfecting, or usually both, to lower the risk of spreading infection. And then sterilization is really killing all organisms. So it's destruction of your of all microbial life, your bacteria, your viruses, your spores, your fungus. And sterilization, we're really looking at surgical packs, things that might be introduced into the body would need to be sterilized to prevent spread of disease that way. But there's no way that we could safely sterilize the kennels in our shelters. So we really are looking at sanitation, which is getting these microorganisms down to a safe level. Main point here is that soaps and detergents and degreasers do not kill harmful organisms, and disinfectants do not necessarily remove dirt or grease. So some disinfectants like Rescue do have good cleaning and disinfectant properties, and others like bleach do not. Bleach is a great disinfectant, but bleach does not do any cleaning. It does not penetrate through those body oils. It does not lift feces or snot or nasal secretions up and clean those away. If you're using bleach, you really do need to have some kind of soap or detergent as your first step before you're applying that disinfectant. And this will be a little more important to talk about when we're talking about diseases like parvo and feline distemper when we get later on in the conversation. So when we're trying to keep the animals in our care healthy, who's the enemy we're fighting? We're talking about those bacteria, viruses, and fungi, parasites that we commonly see in the shelter. And I figure all of you really know what a bacteria or a virus is, but I did throw some common definitions on this slide because they contain some key points, as well as examples of diseases that we might commonly see that are in the shelter. So the first key point to know is that when we're talking about your viruses is that they can be what we call enveloped or non-enveloped. And this simply means, do they have a protective membrane that surrounds their proteins that are actually responsible for replicating the virus? And enveloped viruses have this protective membrane and non-enveloped viruses do not. And this may seem so the envelope viruses are actually the easier viruses to clean. And this is because disinfectants disrupt that protective membrane and prevent the cell from the virus from actually attaching to the cell and causing infection. And this always seemed counterintuitive to me. I always thought in the beginning that the envelope viruses, that would provide a protective layer and actually protect the virus from disinfectants, but it's the opposite. It actually makes them easier to clean, whereas your non-envelope viruses are very hardy and persistent in the environment, and those are your things like Panleuk, feline or parvovirus, calicivirus. They're your non-envelope viruses. And then bacteria, they also have cell walls that protect their proteins and cell content. And this means, like the envelope viruses, they're generally a lot easier to kill and don't persist as well in the environment because unless they're suspended in a wet, kind of moist environment, then they can live for a few days. But if it's dry or proper application of most disinfectants, you're going to be able to take care of your bacteria fairly easy. And then, of course, when we're talking about fungi, we're talking about the big one that we see, which is ringworm. And actually, what makes ringworm difficult to get rid of are the spores that are formed by the fungus. And unlike envelope viruses, fungal spores are actually very hardy and protect the organism from disinfection, which is why we have to go to fairly high concentrations of disinfectant to take care of or look at bleach. And then for external and internal parasites, that's something that is spread through, that lives on a host or in a host organism and gets its food at the expense of the host. So we're talking external parasites like fleas and ticks, and internal parasites are roundworms, coccidia, and giardia. And we'll talk specifically about how to manage those with cleaning when we get later on in the conversation. So when you're building your sanitation plan, it's helpful to know how organisms are transmitted. And so there's essentially a few different modes of transmission for diseases. One's through vectors, and that's living creatures such as fleas and ticks, which transmit disease. You have droplet transmission, which is disease that spread from respiratory droplets from coughing or sneezing. And typically when we're talking about droplet transmission, the droplets are big enough that they really only travel maybe 4 or 5 feet after the animal sneezes or coughs. They don't suspend themselves in the air. They don't travel very far. They just kind of are expelled and then sort of drop down to the ground. We have airborne transmission, which are diseases from respiratory droplets that do travel distance. They're smaller respiratory droplets, and so they can really get kind of aerosolized in the air, and they can go kind of all over a room. We have direct contact, which is diseases spread via body contact. So a dog comes into direct contact with another dog. And these are very common way, a direct contact is a very common way that disease is spread in the shelter. With indirect contact, we're talking fomites, and I'm sure everybody knows what fomites are. They're basically anything that can carry a germ from one place to another and infect another animal or person. Feline upper respiratory, canine upper respiratory, ringworm, parvo, panleuk, pretty much any disease we're dealing with in the shelter is often transmitted through indirect contact. And it's a particularly common route of transmission for diseases that are of particular concern. So ringworm, parvo, panleuk, those diseases that live in the environment for long periods of time, this is a major spread of transmission for these organisms. So when you're building your sanitation plan, you really need to look at what needs to be cleaned. It's really easy to focus in on those cages and kennels. Germs are spread by human and animal traffic throughout your shelter. A kennel will only contain the germs that belong to that animal living there, but visiting rooms, exercise yards, carriers, clothes, exam tables, they're going to have germs that are passed on as multiple animals go through that environment. And so you really want to focus in on the areas that are the most important. Those would be your pre-vaccination surfaces. These are surfaces where animals are first coming into your shelter, and the animals may not have a vaccination at that time. So your intake offices, your animal transport vehicles, the clothing on your intake staff, you're really going to want to sit down and look at those areas and figure out how you're going to clean them. Another one you're going to want to pay attention to are your high contact surfaces. So these are surfaces that many animals or people will touch. Again, your exercise areas, your get acquainted rooms, and exercise areas can be particularly tough because they are often very difficult to clean. There might be grass or gravel. And so you really need to pay attention to those areas when you're designing how you're going to clean them. You know, the worst case scenario is you have a dog who's not sick or showing symptoms of parvo, but is actually shedding virus. As Dr. Hickey said, they really can be in this place where they're not looking that sick yet, and they're out in your exercise yard, they defecate, they are shedding parvo, and then you have other puppies coming into that area that are playing, chewing on things, pick up that parvovirus, and then you have the next thing, you have parvo in multiple puppies in your or animals in your shelter. Don't forget about things like telephones, doorknobs, these kinds of items. If multiple staff are cleaning and handling animals from different areas, and then they're all coming to a central area and using the same telephone, then if they have any kind of germs on their hands or clothing, they could transfer that to the telephone, and then another staff will pick up, use that same phone, and then go take care of some other animals, and pretty soon you have germs kind of going all over your shelter from this one central location. The other thing you want to do is pay particular attention to animal housing areas between occupants. So especially if there's puppies and kittens or sick animals. So we're not as concerned necessarily about spending a lot of time cleaning animal cages that have animals that are staying in there. But once that animal leaves and before another animal comes into that cage or kennel, you really want to pay attention to making sure that that is well cleaned, so that you're not spreading contagion that way. And then of course we want to pay attention to ourselves. We move around our shelters and rescues and more than our animals do even. And so we really want to invest in keeping our hands and our arms, our clothing, our feet clean, either by cleaning them, hand washing, or using protective garments. And paying attention to yourself and how you're moving germs around the shelter potentially will often go as least as far as environmental cleaning, so at least as far as actual sanitation and cleaning and disinfection in preventing disease spread. So when you go back to your particular organization, you really want to ask yourself, you really want to take a look at all of the things in that environment: tables, clipboards, kennel card holders, and really sit down and look, how often is this item being touched? How many different people are touching it? How often should we be disinfecting it? Should we do it daily, weekly, annually? Maybe we just pay attention to doing it during an outbreak, because we only have so much time. And so you really want to very critically look at everything kind of in your environment and decide where and when you need to be cleaning it. For example, one of the things that I will often hear from other shelters when they're having a ringworm outbreak is they're spending all of this time really scrubbing and cleaning the kennels that the animals are contained in or living in, but then they're not thinking about things like air vents, under kennels, tops of kennels, drawers, cabinets, laundry that might be in that room that could have fungal spores on them. And so you really want to kind of critically look at all of those different areas and decide how and what needs to be cleaned. Because you could spend, again, hours cleaning those kennels, but if you're not taking care of the rest of the environment, you're actually probably not taking care of the spores that are passing on ringworm to other cats. So what products should you use for sanitation in your facilities? There's really no easy answer to this question because no single product is appropriate for every situation. Cleaning and disinfecting agents need to be safe for people, they need to be safe for your animals, they need to be cost effective, and they need to be practical given your shelter strengths and limitations in staff, how your facility is designed, and those kinds of things. But there are specific things to keep in mind when you're choosing your disinfectants. The first one is, what are the products cleaning versus disinfectant activity? So some disinfectants, like I said before, are really good at cleaning and some are terrible. Again, Rescue is a good example of one that is good at both cleaning and disinfecting. In fact, it's labeled for one-step cleaning, so you can apply Rescue, scrub, and then rinse, and it is considered sanitized. Trifectant, your quats, like Rocal, Kennel Saw, they do have some detergent activity, and they're pretty effective in the presence of organic material, so they're not a bad one either. Trifectant is a little bit difficult to mix and properly use, but it's a very good example of a good cleaner and disinfectant. Again, bleach and those products related to bleach have no cleaning activity, which means they do really poorly in the face of the organic material. And so they do require a cleaning step prior to applying that disinfectant. Applying even straight bleach to a contaminated surface is not going to have the effect that you want and likely won't be able to penetrate and kill all the germs that you're trying to. The other specific thing to consider is what organisms are these products effective against? So what is their spectrum of effect? Rescue, trifectant, bleach are all good against those non-enveloped, those really hardy viruses that live in the environment. Quats, so earlier I said that quats have a reasonable activity even with organic material, and they are listed as effective against your envelope viruses like parvo and feline distemper and calicivirus, but they are not, research has shown that they are not living up to what their product says in terms of being actually effective against envelope viruses. So if you're dealing with a community or your shelter sees a lot of those particular diseases, then you may want to consider either not using a quat or perhaps going to a rotation where you use both a quat and another disinfectant that is effective against those diseases. I'll often see shelters that will use a quat and bleach, and I think that's a great rotation. So they might do bleach a couple of days a week, and then they're going to use their quats the rest of the week. So maybe Tuesdays and Thursdays are bleach day, and the rest of the week they're using Parvasol. Again, you're going to hear me probably say it 50 times, but if you're going to use bleach, you have to use a cleaner. So on bleach day, that would require rinsing down as much of the organic material as you can, applying your soap, Dawn, degreaser like Zep, scrubbing, rinsing the kennel, making sure that all visible signs of contamination, all organic material is gone, and then applying your bleach, allowing it to sit, and then rinsing your bleach and squeegeeing. So it does add a little bit of time to go with that kind of a process, but it's a perfectly acceptable process. Again, there's a lot that are right to do. You just have to know what is wrong so that you're not thinking that you're doing the right thing when in actuality, you're not killing the organisms that you need to. You want to make sure you're using the proper concentrations of these disinfectants and for the proper contact time. I think the general rule of thumb for proper contact time for almost any disinfectant we use in the shelter commonly is 10 minutes. We'll talk about rescue a little bit because that does have a 5-minute contact time in some situations. But you want to look at your product label for the recommended concentrations to kill the organisms that you're trying to kill. So rescue at a 1 to 64 concentration or a 2 ounce per gallon, that's going to take care of most of your envelope viruses and your bacteria. A 1 to 32 concentration with a 10-minute contact time, and we're specifically talking about rescue here, will take care of your non-envelope viruses, so that Panleuk and parvovirus again. And then a 1 to 16 concentration will inactivate your non-envelope viruses with a 5-minute contact time, and will also take care of your ringworm spores. You really want to look at your labels and talk to your reps to see what your particular product, what the concentrations that are recommended, and how much time they need to penetrate to actually sanitize surfaces. But this is also where cost can come into play because a lot of these disinfectants are not cheap. Rescue can be rather pricey. It's a great product, but it's not cheap. And so again, if you have mostly vaccinated animals in your rescue or your organization, and you don't see a lot of animals, a lot of change of animals, a lot of new animals coming in, a lot of new animals coming out, maybe you're a foster home based rescue, or a rescue that sees animals that just stay in your environment for a long period of time, then you might want to go with your lower concentration. You don't see parvo in your community, you don't see a lot of distemper, maybe you go with your lower concentration, and then you use that kind of mid-range 1 to 32 or 4 ounce per gallon concentration of rescue. If you do happen to see a parvo case, and so then you use that to clean up. But some people will choose to go even to that like 1 to 16 concentration. So they're going to go right to the highest concentration. The issue with that is if you're going right to that high concentration, you're using about 4 times as much as the low concentration of rescue. And it's often not necessary because, again, you can get into that mid-range concentration and it will take care of those envelope viruses as long as you're properly applying it and giving it the appropriate contact time. So at DFL, we use rescue, and we spend about $12,000 to $16,000 a year on rescue alone. If we were to go to the high concentration for everything, we typically use for most things the mid-range 1 to 32 ounce concentration. If we went to that high concentration, we would almost be, that's potentially doubling our cost for cleaning, and it's not necessary. So you need to pay attention to kind of the cost and balance that with the diseases that you're looking at and the types of organisms you're looking at to make the most effective decision. Again, using bleach and Parvasol could be cheaper, it could be more affordable for you, but you're looking at more time to perform that cleaning because you do have to do that two-step process with your Clorox or your bleach. And so maybe if you're spending too much staff time, could potentially be not providing as good a care for all of the animals in the shelter. If you're spending all this time taking care of a small number of animals because it's taking you so much time, then you may not be getting the desired effect either. Or if staff time, you could be balancing out paying more staff time for cleaning because it's taking you twice as long to clean. So you have to kind of balance those out with your individual situation. How many animals, what's your staffing like, what's your facility like, and those kinds of things. So you've picked the products, you know what needs to be cleaned. Now, what do you need to consider when you actually start your cleaning process? You also need to pay attention to what your order of cleaning is. And this applies to a small room or a large, your whole facility. So when you come into a room, you want to look at, do you have puppies and kittens in this room? Do you have adults in this room? Do you have, maybe you hear you're in a cat room. Do you hear sneezing? Do you see ocular or nasal discharge? So do you have some cats that are breaking with upper respiratory in this room? And then you want to clean accordingly. So you want to pay attention to that order of cleaning. And typically you're going to want to clean your most vulnerable populations first. So that's your kittens and your puppies. And then you want to go to adult animals and then to sick animals. And then you want to also consider cleaning your population that's at the least risk. So that's your adoptable animals. They've been in your shelter for a while. You've seen that they're not breaking with disease. They haven't come in with something. And so then you would go to your stray animals because you don't know as much about their health status. They may have only been in your shelter for a couple of days. You don't know where they came from prior to that. So you would want to consider those next. And then you would want to consider your sick animals. So a good kind of rule of thumb is adoptable kittens and puppies first, and then adoptable adults, stray kittens and puppies, and stray adults, and then your sick animals. But again, this can apply to a room as well as to your whole shelter. So if you walk into a room, you would want to clean your kittens first, then your adult animals, and then if you have any sick animals, ideally you would move them to an isolation or quarantine area, but if you don't have that ability, then you would want to be cleaning them last. The other thing to pay attention to is you want to minimize stress, especially for your cats. So utilizing spot cleaning, which we'll talk about here in a second, avoiding moving cats from cage to cage, which can activate some of your upper respiratories like herpes virus. Many cats actually already are carrying herpes virus, but they're not sick. They get stressed out, and then the herpes virus activates. They start showing symptoms, and then they're contagious to other cats. At one time, I was in a shelter, a fairly large shelter. I think they saw about 10 to 15,000 animals a year. They had an incredibly high population of cats. I've actually never really seen anything like it. They were also dealing with a very severe Panleuk outbreak in their community. And we were walking through their shelter and talking to them and kind of looking at their operations, and we all noticed that they had this really low rate of upper respiratory infection. And we were asking them about the panleuk in their community, and were they having problems with it spreading inside their shelter, because they did have this high cat population at the time. And they actually were not seeing panleuk outbreaks with animals that were already in the shelter. So they were having animals come in with panleuk, but they were not seeing it spread to the other cats in their shelter. And they also had this really low incidence of upper respiratories, like 0.02%. And so we were just chatting through with them about that, and we found out that what their procedure was is that every cat coming into their facility got a feral cat den. So that was from animal control to adoption or outcome for that animal. So their animal control officers, when they picked up a cat or a kitten, they would put it in a feral cat den. If it was a litter, they'd put it in a crate, and then that feral cat den stayed with that cat through the entire stay in the shelter. So when staff were cleaning, they would sort of gently usher the cat into the feral cat den. When the cat went to surgery, it went in its feral cat den. It came back to its kennel in that feral cat den. It went up for adoption in the adoption kennels in their feral cat den. And it was, I thought, a really great example of how, A, those cats had their own space, their own smell. There was not a lot of handling of these cats, and they could stay in their own environment, kind of their own little micro environment in their kennel during cleaning. And that just went so far in minimizing disease spread with this panleuk outbreak that they were having. And so if you can get away with that, if you have the ability to do that, it would be definitely worth considering, in my opinion, for your cats in your shelter. But again, you also want to minimize stress for your dogs as much as possible, minimize taking them from place to place in the shelter, because again, that can be a huge source of disease spread. When you are cleaning, you want to minimize fomite transmission. So don't let animals run loose on the floor. Don't let those cats and kittens be running around on the floor while you're cleaning. Again, using those feral cat dens or a carrier. If you're going to use a carrier and it's not staying in the kennel, if you have the ability to give each animal its own carrier, as opposed to taking a cat out, putting it in a carrier, cleaning its cage, putting that cat back, and then reusing that carrier. Even if you're cleaning in between, it's difficult when you're really looking at these hardy organisms to make sure you're getting effective contact time and really getting the mechanical cleaning that you need. And so that can be a huge source of disease spread in your shelter. And then also, I think Dr. Hickey talked a little bit about making sure you do change clothes, particularly if you're going from a sick area to a clean area, using PPE like smocks, your disposable gowns and gloves, and then washing your hands kind of between areas and when you're done cleaning. For these really serious risk diseases, these diseases that have really serious implications in the shelter, like your parvovirus, considering, well, you really definitely need to be using either disposable or dedicated shoe covers. So you can either use disposable shoe covers that you just take off and throw away, or shoe covers that stay in that room. And then as you put them on when you walk into the room, and then as you leave that room, you slip out of them and they stay behind. So again, when you're thinking about what you need to be cleaning and not cleaning, think about your cages as kind of their own little subset. It's one of the dirtiest activities we actually do in our shelter. I mean, think about it. There's hair, there's feces, there's food bits. They all get stirred up when you're cleaning. They attach themselves to your clothing, your hands, your arms. And if your cleaning requires a high level of animal contact while you're cleaning, you have that overstim cat that just wants to rub on you and be your best friend while you're trying to clean. Those can really be a huge source of fomite transmission in your shelter. So and that's one of the reasons why we recommend for an occupied kennel doing what we call spot cleaning. And there's a lot of good videos out there. ASPCA Pro is a good website. If you Google spot cleaning a kennel, you can see videos, handouts, procedures for the step-by-step on how to do a spot cleaning. But essentially what we're talking about is really just tidying up that cage. If it's a cat kennel, we're talking about dumping that litter, freshening up that litter box, freshening the food and water, but but not necessarily removing bedding. We want it to stay with that cat so it has its smell, minimizes stress, helps the cat stay healthier in the shelter. And then when we are looking at that cat or that dog has left that kennel and before another animal comes into the kennel, then we want to do what we call deep cleaning. This is where you're pulling out all of those items from that kennel. You're applying your cleaner, your degreaser to break down the body oils, lift any of those germs off the surfaces that have built up. And then you are rinsing that away, applying your disinfectant at the proper concentration and contact time. And then if needed, rinsing that away. This is where you would want to go with your maybe your mid-range concentration if you are using rescue, so that you can make sure that you take care of any of those non-enveloped viruses. And then the third cleaning that we talk about is contagion cleaning. And so this is when an animal has maybe been in a general housing and it's broken with parvo, or for your isolation areas. And contagion cleaning is essentially deep cleaning 3 times. So you're going in, you're removing all the items, you're applying your cleaner, you're going through the steps of cleaning, you're applying your disinfectant, then you're allowing that to sit for its 10 minutes of wet contact time, and then you're wiping that up or allowing the kennel to dry is actually the preferable method, is to just, if the cleaner or the disinfectant that you're using does not need to be rinsed, then you just allow it to sit and dry, and then you go back and do that a second and a third time. And somebody asked me once, why 3 times? And I was stumped. I was like, I don't know, why 3 times? It's just the thing that we do. But it's really an arbitrary number. It's as long as you are confident that you have removed all of that organic material that might be harboring the bacteria or virus, you can do a deep cleaning once. You don't have to do it 3 times. But again, we're talking about really hardy bugs that can persist in the face of even some disinfectants. And so you want to make sure that you're removing all of that organic material so that your disinfectant can actually work and has the proper amount of contact time with the organisms you're trying to kill. And so by doing it 3 times, you're ensuring that you've removed all of that organic material. You're ensuring that that disinfectant is getting on every part of that kennel and sitting on there for the appropriate amount of time before you put another animal in into that kennel. And Dr. Hickey touched on some of this as well, but I'll go over a little bit of it too. Kind of those miscellaneous cleaning topics like dishwashing. You can use dishwashers. They need to have a high heat dishwasher. There's definitely information out there on the UC Davis Shelter Medicine website on temperatures, but it does need to be the temperatures that your dishwasher needs to reach to actually sanitize your dishes. But you do want a high heat dishwasher if you're using a commercial dishwasher. And between that kind of high temperature and the mechanical cleaning that happens with those dishwashers, they're generally sufficient even for your parvo and your pan-luke. If you're hand washing dishes, you want to wash the dishes with soap and then rinse them before you're disinfecting. So I have seen people put bleach water in a sink and then put dish soap into the sink and clean their dishes with the idea that it's going to take care of both the cleaning and the disinfecting. Dish soap can kind of interfere with the effectiveness of bleach. And so you want to wash, remove all the food residue, any fecal contamination, those kinds of things. Rinse thoroughly and then apply or soak those dishes in your disinfectant. You want to consider separating your toys from your dishes from your litter boxes. So if you're looking at an order of how you're doing those items, you would want to clean your dishes first and then your toys and then leave your litter boxes for last. You don't really want to be mixing those items. You can launder most towels and blankets that you need to when you're considering what the germs that you're trying to get rid of. You want to use hot water. You can use bleach. You don't need to use any more than your usual laundry amount. Dry in the dryer or direct sunlight should take care of those organisms. You don't want to overload your washing machine. That's an important factor because that can allow the hair and any poop to kind of hide out amongst the laundry. It doesn't get properly mechanically broken down and then taken out in the rinse cycle. And so that can retain infectious agents, even in the face of an otherwise effective laundry protocol. I would not recommend, and I think Dr. Hickey said the same thing, if you have known laundry from an animal that had parvo, had Paleuk, and it has fecal contamination on it, you don't want to, the safest thing is to just throw that out. You really don't want to take the risk that those viruses might hide in that laundry and survive the laundry cycle. Some people use a separate bleach and or a separate detergent and then bleach cycle. So if you have a rinse cycle between your detergent and your bleach, you're probably fine. But if you don't, you might want to do a soap cycle first and then use a bleach or disinfectant cycle. A little comment about power washers. They can be great for really blasting materials off of surfaces, but that's also their problem is they aerosolize those things. So if you have parvo and poop and you're blasting that with a power washer, you're actually aerosolizing that up into the environment and kind of spreading it all over the room, and it can be a particularly nasty way to contract parvo. When it's inhaled, it can cause particularly aggressive disease. So you really don't want to be power washing when animals are present. If you can help it, if you can get them to one side of the room, you can do that. You also want to pay attention to your staff. If they're using power washers, you want to make sure they have something that's covering their face so they're not breathing in that stuff. Mopping can be problematic. We highly recommend using a mop with a catch bucket to kind of prevent your water from getting as contaminated as quickly. You definitely don't want to be taking mops to different areas of your shelter without changing out your water, your disinfectant, and preferably changing your mop head. You want to clean your mop water, or you get new mop water when you see that it's really visibly soiled, and you want to make sure that you have the proper disinfectant. Again, if you're using bleach and there's any poop or hair or contamination in your water, chances are it's not actually killing what you're hoping it's killing. Something, again, with a little more cleaning activity like your bleach or your rescue or your trifectant or your quats, they would be okay in the face of some organic contamination. But again, the more contaminated your water's getting, the less likely it is to be effective. And you can actually spread germs from place to place on your mop bucket. So as you're getting your fresh water, you're coating your mop and all of these things, and then you're spreading it to other areas. A better method than mopping can actually be squeegeeing. And if you don't have a drain, you can actually squeegee into a towel. That seems to do better as far as keeping those bacterial and viral counts down on your floor. And then don't forget about your things like your leashes, your transport vehicles, your carriers, and making sure that they're getting appropriately cleaned. Especially equipment that comes into contact with multiple animals. you definitely want to make sure that those are getting appropriately cleaned. And for some organizations like animal control officers who are out in the field, or there's not a sink, if you're in the shelter, there's not a sink in a close proximity to an area that you're cleaning. Some places have gone to using rescue wipes. So those disinfectant wipes to kind of clean their hands or clean equipment in between animals. And I know I'm getting a little short on time, but so I'll try and get through this as quick as I can, but still be still provide good information to you. But for foster homes, the biggest problem with foster homes is that they, shelters are sort of designed to clean. Foster homes, your home is not really designed to be easily cleaned. So if you do have you have a foster parent that has a pan-loop kitten, you really want to take into consideration what in that home needs to be cleaned. A lot of times just simply cleaning gross contamination and then waiting a period of time will be okay in preventing another animal coming into that foster home from getting sick, because those organisms will kind of die off naturally. Contaminants that are can be dealt with in this way are things like Bordetella or kennel cough, distemper, FELV, FIV. They're things that, again, they're those envelope viruses, so they will die off kind of naturally on their own. They just don't do as well in the environment. And that gross kind of contaminated cleaning is, you want to make sure you get all the hair up, you want to make sure you get the poop up, you thoroughly vacuum, you thoroughly scoop the yard, you launder soiled bedding, toys, clothing, that kind of thing, and then you wash and disinfect your food dishes and litter pans. But if the worst happens and you get one of those hard to disinfect areas contaminated with one of the serious pathogens, like, again, parvo, here's some things to consider. You want to take inventory. Think about everything that infected animal may have come in contact with, and you want to go back a few days. Were they in a personal car? Were they in a transport vehicle? Were there clothes or towels or blankets they may have touched, toys, crates, or beds you need to worry about? For shelters, think about the kennel areas and the area of the shelter where the animals may have passed through. That's your get acquainted rooms, your offices, your play yards. Also, you have to consider animals that might be exposed but aren't carrying or showing signs of disease yet. You want to clean, rinse, and repeat. So if you can't kill the pathogens, in some cases you can remove them by repeated washing and vacuuming. So outdoor areas, for example, you want to flush with plenty of water and then allow that area to dry thoroughly between bouts of irrigation. And you would want to do that multiple times. You can use rescue in outdoor yards. You can use rescue on grass, and it has shown some or reasonable efficacy, so it does work okay. But it's still really important to remove that organic material as much of that as possible. For indoor carpeted areas, you want to thoroughly clean and vacuum. Make sure you get under the furniture, into those nooks and crannies. Steam cleaning is unlikely to reach a high enough temperature to really kill these durable pathogens, again, your parvo, but it can help kind of mechanically remove the feces and remove those pathogens. You can use rescue on carpets, and there's other disinfectants you can use on carpets, but you do want to test for color fastness before you just put it on there. I will tell you from personal experience, rescue will bleach your carpets. And then you want to kill what you can. So again, picking a disinfectant that works against your whatever disease that you're trying to take care of in that foster home, which typically is going to be your parvo or pan-luke. Looking at what you're trying to clean. So if there's a bunch of porous surfaces, wood, unsealed wood, carpets, that kind of thing. Bleach is probably not going to want to be your go-to because it doesn't penetrate well onto those surfaces. And obviously bleach is really going to bleach out your carpet or change your color carpet. So again, looking at what's the best disinfectant for that situation. Is that rescue? Is that trifectin? Is that quat? Again, if it's a parvo or panluke, you're not going to want to use a quat for that because it hasn't been shown to be effective. You can assess the risk. So for ringworm, you can tell if you, one good way to tell at least is if you have done a proper cleaning is you can do an environmental culture. So you basically go and take a toothbrush and or a Swiffer and you kind of brush it over the entire environment, tops of counters, that kind of thing. And then you tap it onto that culture plate and you can see if you can grow ringworm. And so that's a good way to know if you've completely decontaminated a particular area so that you know if it's safe to put in another animal. And the one thing I'd like to say is that this is all about kind of cost benefit analysis. We're all about sort of balancing those risks and benefits. It's rare that we get a no risk situation. So the risk of reopening an area, the risk of reopening a foster home, you kind of have to balance how well can they clean that environment? What's the cost if we don't have that foster home? Does that mean we're going to have a litter of kittens that we could get out into a foster home, but now it's going to have to stay in the shelter where it's going to be exposed to disease for sure because of all the other animals in our shelter? You really kind of have to balance that with what you're dealing with. And then just allowing time to happen as well. So some foster homes I've heard they've cleaned really well after a parvo or panluke exposure. They've disinfected where they could, and they've taken in new puppies and kittens after a month and they've never had a problem. And other foster homes I've heard have done the same thing. They don't seem to have any more or difficult surfaces to clean, and yet they bring in another foster animal and they go ahead and contract parvo. In some cases, I've heard of that happening after 6 months or even a year. And so I think for the Dumb Friends League, if we have an animal that gets sick in a foster home and they do all the cleaning and then we put another animal in that foster home and it gets sick again, then we'll ask them to wait that year. And if that after a year they get sick again, then we might just say, all right, there's something in the environment that you just can't clean. It's nothing. It's not a statement about how well they're cleaning. It's just there's something there that they can't really effectively clean. And so maybe we just look at putting adult animals into that foster home or a behavior animal that isn't at high risk like a juvenile would be. So let's kind of try and put this all together and look at sort of the sanitation considerations for different diseases. So first you're going to want to look at what type of organism you're dealing with. So is it a virus, is it bacterial, or is it both? Because in the case of, like Dr. Hickey said, in the case of canine and feline upper respiratory infections, sometimes you have a virus, sometimes you have a bacteria, or sometimes you have both. You want to look at how it's transmitted, and in the case of most upper respiratory, it's droplet or aerosol transmission through that indirect or direct contact with a sick animal. So the good news is for most of your upper respiratory pathogens, they are inactivated by all routine disinfectants. So your quats, your bleach, your rescue, chlorhexidine, we're mostly really talking about unenveloped viruses. There's a couple of exceptions and I'll get into them, but you're really talking about those envelope viruses, I apologize, not non-envelope viruses. And so they're pretty straightforward for cleaning. They can live in the environment, particularly a moist environment, for 2 or 3 days up to in some cases, but for the most part, they're not things that are going to last for months or years in the environment like that parvo and panluke. When you do have upper respiratory animals in a foster home, you want to keep them isolated from any resident pets. You want to make sure that your foster parent is giving the medications after they've taken care of their own pet, so that they're not potentially taking that back through that indirect contact to their own pet. And then not taking pets that have upper respiratory, not taking dogs that have upper respiratory to like doggy daycare or play yards, pet stores, dog parks, that kind of thing. So one of the big exceptions to the upper respiratory, when I said that they're envelope viruses, are calicivirus. So that is an unenveloped virus. It means that it is more difficult to kill. It means that you do need to go with a disinfectant that is labeled for use for your unenveloped viruses. Primarily found in saliva and ocular discharge. Fomite transmission is a huge source of transmission in the shelter because, again, it can live in the environment for quite some time. You really need to pay attention to your food dishes, your water bowls, even your clothes, because cats will groom themselves, deposit the virus on their skin, on their hair. You pick up the hair, and then another cat rubs on you and then grooms themselves, and it could be a source of transmission. Calicivirus can live in the environment for about 30 days in dried nasal secretions. And so, again, you want to, anything you're using to clean for calicivirus, you want to make sure it has good cleaning activity. It can break through that organic matter to allow that disinfectant to work. And I'm probably going to breeze through the rest of these because we really are getting short on time. The big thing to sort of remember again is, am I dealing with a virus or a bacteria? Is it an unenveloped or non-enveloped virus? Is it an enveloped virus? How is it transmitted? You know, is it fecal oral? Is it respiratory droplets? If it's respiratory droplets, I want to make sure that if a dog is sneezing and it sneezes on a leash or my hand, that I'm making sure those are cleaned. If it's fecal oral, I want to make sure that I'm getting rid of all of that poop. So again, pan-luke, distemper, unenveloped virus, want to make sure that you're using a product that is labeled and effective against those. You want to make sure that you are sort of paying attention to what surfaces you're trying to clean and what is going to work on those surfaces. Same thing with parvo, again, another unenveloped virus. Fecal oral contamination through indirect or direct contact can survive for years in the environment in some cases. I did hear of a person with a Rottweiler that had a litter of puppies. They unfortunately contracted parvo, tried to treat all the puppies, none of them survived. Talked to the veterinarian, decided that he literally went through and scraped away like 4 inches of his ground in his yard, and waited a couple of years and then tried to have another litter of puppies. And indeed, that litter of puppies also contracted parvo. And so what was determined is that he had not moved the doghouse because it was a really big doghouse and the puppies were like digging under that doghouse, and the parvo was in there. And even though he filled up all the holes, that parvovirus just lived there for years in that nice, warm, kind of consistent temperature environment. And when those puppies were digging on, the new puppies were digging under the doghouse, they indeed contracted parvo and got sick and unfortunately all died. So again, that's just another example of sort of paying attention to what needs to be cleaned, and really looking at even the most innocuous thing and saying, oh, could that be a source of this particular contagion? So with canine distemper virus, it's an envelope virus. So that's good news. It means that it's pretty easy to clean. Again, lives in nasal secretions, actually can really be found in almost any body secretion. And so you do want to make sure you're doing a good mechanical cleaning. You're using a product that will work to get rid of and break down that the snot and the nasal secretions. doesn't live for a long period of time in the environment, 2 or 3 days in the proper environment, again, in a moist environment. So you do want to make sure that you have good drying of your kennels and areas before you're introducing another animal. So strep zoo, Dr. Hickey touched on that one a little bit. It is also a bacterial infection. Route of transmission is airborne, direct or indirect contact. Again, good news is that since it's a bacteria, it's pretty easy to disinfect. But there is evidence that it forms biofilms, which kind of help it survive in the environment, which again reinforces that need for good mechanical cleaning prior to disinfection. You definitely want to make sure that you're cleaning your water bowls, you're getting those thoroughly dry. I know some people will just dump water bowls and kind of spray and then rinse them and then refill them. If they're not getting properly dried in between one animal and the next, they could serve as a source of contamination. Also want to look again at your leashes and that kind of thing. So ringworm, again, is a fungus. Route of transmission is basically hair and skin particles that are shed into the environment that carry these infective spores. So direct contact or indirect contact are major source of transmission. A lot of research, or a lot of, research, I'll say, has been done, and it really shows that kind of mechanical cleaning plays a really important role in ringworm. So taking Swiffers, they work very well because they sort of electrostatically kind of pick up all the hair, and using that to kind of wipe all your surfaces. This is particularly important potentially in a foster home environment. Again, surfaces that aren't easy to clean. So if you can use something that will kind of pick up as much of that hair and those ringworm spores as possible, then you have a much better chance of killing the spores that remain. Again, you want to use an appropriate disinfectant. Bleach works well, but as I've said a number of times, if there's any kind of organic material left behind, it could prevent the bleach from actually killing the ringworm. Porous surfaces that are difficult to cut, they're not, works really great on stainless steel, probably not going to work quite as well on a wooden bench or a kitchen table if you're talking about a foster home. One thing with ringworm is that you do need to look at your concentration. So typically rescue at like a 1 to 8 concentration, or bleach at a 1 to 10. Typically most bleach are doing a 1 to 32 ounce concentration, but with ringworm you want to look at that 1 to 10 ounce concentration. The one caution I'll say with bleach is that there's a lot of different concentrations of bleach out there on the market now. There's 5%, 8%, and so you want to make sure you are doing the proper dilution. There are kind of bleach calculators out there. ASPCA Pro has a great one where you can put in the concentration of your bleach and it will tell you how much bleach to water that you need to have either a 1 to 10 or a 1 to 32 ounce concentration. And bleach can be particularly nasty if you use too much of it. It's caustic. It has a lot of fumes that can be very irritating to cats, in particular nasal passages. So making sure that you have the right concentration, because obviously if you have too little concentration, then you may not be taking care of the ringworm spores like you think you are. Briefly, intestinal parasites. Really, when we're talking about our intestinal parasites, Coccidia, your Giardia, your roundworm, they can persist in the environment for quite a period of time, and really anything, essentially you need a flamethrower to kill them with a disinfectant. Any of the disinfectants we're commonly using in shelters are really not going to kill these organisms per se, or they're not going to easily kill them. So we really rely more on prevention, deworming, and medications than we do proper concentrations of disinfectants. Some disinfectants will take care of Giardia and Coccidia, but again, it's just easier, more effective to use a good deworming than to rely on disinfectant to take care of these organisms. external parasites are also not routinely killed by disinfectants, at least at normal concentrations, and especially in a home-like environment, that's true. So pesticides, flea and tick, Revolution, Frontline are really recommended if you have flea and tick problems. Medications for mange, you can work with your veterinarian on that. So we're not really looking at disinfecting to control external parasites either. Vector transmission, because these organisms are typically go from an infected animal and they have to penetrate, you have to have saliva to blood contact to pass these organisms. We're not really considering disinfection when disinfectant is not a way to control rabies because rabies will not survive outside the environment. So we don't really need to consider vector transmission per se when we're looking at a disinfectant protocol. And so that is really the things that you kind of need to consider. I know I went through some of it very quickly. There is some repetition there, but if anybody has any questions, I'm happy to try and answer them. Any specific situations that they are wondering what might be the most effective way to manage cleaning.
Great, thank you so much, Elaine. If you want to put your email right in the